Hello and welcome. Our guest for this edition of ASTA is David Morgan with the State Health Department's Los Cruces office. David, welcome back. Good to have you with us.
Good to be here again, Udell. Thank you.
All right. Okay, so you're going to be having a flu clinic this month. Please tell us when and where.
Yes, we are working with the two local hospitals, both Memorial Medical Center and Mountain View Regional Medical Center, for our annual Boot to the Flu event. It's a flu vaccination clinic that is done annually in this community. It's the second year that both hospitals are doing this simultaneously. It's coming up on October 28th from 8 a.m. to noon while supplies last.
Great. And how exactly does it work? Do you you have to get out of your car? Is it a drive-through service?
For adults, it is a drive-through service. We can offer walk-in services for adults, but we especially have walk-in service to be able to vaccinate children.
Okay, very good. Now, who can take advantage of this free flu vaccination clinic?
It's really a matter of who can't. Bottom line, the New Mexico Department of Health encourages anybody ages 6 months or older to get their annual flu shot. But particularly what we want to see kids being vaccinated, pregnant women, older Los Cruces over the age of 50. And anybody that has their immune system compromised, whether it's through diabetes or asthma, heart disease, something like that.
And do folks who participate in this clinic have to take any kind of documentation with them?
We do ask if you're insured to bring your insurance card, or if you have Medicaid or Medicare, bring your card. But regardless of whether anybody brings the card or not, while supplies last, people are going to get their flu vaccination.
That's great. So there's really no reason not to.
We really like to think that there is no reason not to. This is super important to be able to get the vaccination. Because really, it's not just keeping you healthy, it's keeping the people around you healthy, to decrease the chances of being able to pass the flu on to someone you love. Whether your kid can give you the flu, or you can make your kid sick, or you go and visit grandma's house, you don't want to expose them to the flu as well. So it's really just about being able to protect everybody and try to keep as many people as possible out of our local emergency rooms for being treated with flu symptoms.
Yeah, good point. That's a good point. Okay, so now, even today, I hear from people that say, I don't want to get my flu shot because I'll get sick if I get it.
Right, and that is that actually was true more than 10 years ago. But they fixed the flu vaccine, and the bottom line is, all medicines today have side effects. So it is possible that somebody could experience minor side effects, of being able to have body aches, that sort of thing. But these are minor. They last only a couple of days, and they generally go away by themselves in the few days' time.
So there's still a long-term benefit.
Absolutely.
Yeah. Okay. Now, very briefly, what are some of the other things we can do to help ward off the flu bug, in addition to getting the vaccination?
Sure, really simple stuff. Washing our hands often, that is always a big one. Both the easiest and the most challenging, because we all have jobs, we all have to go to work. The most easiest, most challenging thing is to just avoid somebody who's sick. Don't have direct contact with them where possible. Make sure that you or anybody around you that is sick, that sneezing, is coughing, is covering up that cough or that sneeze, and just really just be aware that you could spread germs sometimes
sense.
Without even thinking about it.
Yeah, just common sense stuff.
Absolutely.
All right, David Morgan with the State Health Department here in Las Cruces. Thank you very much for joining us.
Thank you, Udell.